Welcome back to the DAMY vlog. On this show, we cover all things holistic health and wellness related. If you're interested in holistic well-being in general, please subscribe to our channel. I'm Dr. David Duizer, a naturopathic doctor and the medical director at DAMYhealth.com. Just finished up a Lean Live for DAMY Lean members. Today we were talking about pain and inflammation in weight loss and how it can be a significant block to your results, and how when you resolve pain and inflammation, it's much easier to lose weight in general. This is the idea around the holistic approach to weight loss. This is what we teach our members, and we see significant benefits from this approach to weight loss in general. Today on the show, I want to cover the reasons why inflammation and pain can be significant blocks to weight loss. Let's go through them very quickly. So number one, I'll start with when you have extra adipose on the body. If you're in the overweight or obese category, we know that inflammatory cytokines are increased. Fat cells make inflammation. People who have excess fat on their body tend to be more inflamed than those who do not have that excess fat. So it's a chicken and an egg aspect here if you don't know your cause of pain and inflammation already. If you know your cause, forget some of this. The mechanisms for pain and inflammation, for their ability to block weight loss. Number one, it's a cycle. So when you're overweight, you become more inflamed. Number two, let's move into it. When you're in an overweight state, you have more stress on the joints. They can become painful and inflamed, which can hinder your ability to exercise. When you're in pain and inflammation because of some other reason, whether it be inflammatory disease or some injury, it's difficult to exercise, which of course means you won't have the metabolic output that you normally would if you were pushing it every day and moving your body like you should be. So those things go hand in hand, those two profiles. Also, when you're in pain and inflamed, you know the toll it takes on the mental, emotional body. It's difficult to exercise, difficult to get out of the house, difficult to eat right when you're significantly fatigued due to pain and inflammation. This usually ends in emotional eating. When someone is discouraged because of pain and inflammation or fatigued because of pain and inflammation, we commonly see them turn to carbohydrates for fuel. It's just a common reaction. We've all been there. After an injury, for example, I'm on the couch, I'm wanting high caloric density foods. It's number one, it's a mechanism for the body to try to recover, but also it's an emotional response to this depression that can set in when pain and inflammation present. We know that major depression, chronic fatigue syndrome, PTSD, and fibromyalgia are all probably inflammatory conditions in general. We see very commonly overeating in all of those conditions, which can lead to weight gain and of course be a significant block to weight loss. These are a few mechanisms for inflammation and pain being a block. Joint pain, of course, is a block because it blocks your inability to exercise. Generalized inflammation can lead to low mood, which is a block to weight loss. Generalized inflammation can also lead to anxiety and then burnout, which is a block to the weight loss and the ability to lose weight in general. So it's important to know that all of these are potential blocks for your weight loss journey in general, and it's important to tie up the cause of your inflammation so that weight loss can be achieved. Here are a few potential causes that we should know. Number one, injury, usually an itis or an inflammation of an area of the body, commonly tendinitis and some sort of physical injury, usually requiring a physical medicine response and a supplementation, anti-inflammatory, anti-pain protocol subsequently. Autoimmune disease is the second cause, whether it be rheumatoid arthritis, lupus, scleroderma, Sjogren's, those ones, they all usually have some sort of joint pain with them. Psoriatic arthritis, we see a lot actually. Those are potential causes of pain and inflammation leading to weight gain. Environmental exposures, so toxin exposures, whether it be physical or mental, emotional, can lead to an inflammatory response and subsequent pain. We know that the body has to deal with all toxins it's exposed to, whether it's from food or the environment, and that sometimes can cause significant oxidative stress leading to a pain inflammatory response. We see mental emotional burnout and increased emotional response, leading to generalized inflammation. We see sometimes food exposures leading to inflammation. We know the body responds to everything we consume. Some things, and in some people, those responses are significant, sending a cytokine cascade, causing inflammatory response in different areas of the body. Food sensitivities in general and negative IgG responses have been associated with headaches and pain and low mood and joint pain, lots of different things. Abdominal pain, digestive concerns, IBS in general. So those are potential causes for inflammation and pain as well. Now, in the terms of treatment for pain and inflammation, that needs to be hashed out with your primary care provider, whether it be a naturopathic provider or a conventional provider. But what we see normally, and in most cases, is fasting being beneficial and the avoidance of foods at night being beneficial. We see the avoidance of inflammatory foods being beneficial. Sometimes with people will do elimination type diets where we're taking a break from the nightshades, we're taking a break from dairy, gluten, and eggs. We're doing these type of protocols in our clinical practice to try to reduce pain and inflammation. We like to know the cause before moving forward, so that's most important. On a secondary note, osteoarthritis is a painful condition that is not always inflammatory. It's not defined as an inflammatory condition, but it is a painful condition that can lead to these pathways to weight gain and subsequent difficulty losing weight. So do not leave osteoarthritis off the list. If you do not see overt signs of an inflammatory response like swelling and redness and heat and pain, then it potentially could be osteoarthritis that's leading to the pain signaling you're dealing with, if that is still on the list. Something to watch out for. That being said, it still could be inflammatory in osteoarthritis, but it's worth getting assessed. So this video has been about the mechanisms for inflammation and pain, why they can block weight loss, why weight gain can lead to them, and how this whole approach is really the foundation of this one part of a holistic approach to weight loss. We love this approach. We think it's so great. We see so many people benefit from it. That's a DAMY Lean approach in general. If you like videos like this, if you're interested in holistic weight loss and holistic health in general, please subscribe to our channel for more informational videos like this one so that you can practice a holistic approach to your own personal well-being. Thank you so much for tuning in. Looking forward to the next video. Hope you check us out again in the future. Have a great week.